So during the day of my breast reduction operation, what will my day look like? This is a very short video, but something I think is important to know for you and your friends and family and whoever's helping you out with surgery. Typically, you'll show up to the surgery center 1 to 2 hours before your scheduled surgery. Now, this will vary depending on where you're having surgery, so make sure you clarify this with your surgeon. You should be nothing to eat or drink after midnight the day before surgery. This can vary between facilities. However, most people want you nothing to eat or drink after midnight. Once your surgeon shows up, they will spend some time marking you. Marking is extraordinarily important in breast reduction surgery, and you can expect this to take about 10 to 15 minutes. Once you roll back to the operating room, it does take approximately 15 to 30 minutes to actually get you ready for surgery before your surgeon even makes an incision. Once your surgeon shows up, your surgery may take a varied amount of time. Some breast reductions can be performed in an hour and a half or less, while others take upwards of about 2 to 3 hours. It really depends on the technique your surgeon is using, the size of your breast, amongst other things. It's important to know that longer doesn't always necessarily mean worse or that anything's going wrong, but remember, these are very finesse surgeries and your surgeon is likely working very hard to get you the excellent result that you deserve. After those 2 to 3 hours, your surgeon and anesthesia team will spend about 30 to 45 minutes actually waking you up and getting you to recovery. You will spend a varied amount of time in recovery depending on the type of anesthesia used, but you can expect to spend about 45 minutes to an hour there at the very least. So our total time in terms of how long does it take to actually get your breast reduction done that day can be anywhere from about 3 to 6 hours depending on where you're having surgery and the techniques that's used, amongst other things. It's important to block off an appropriate amount of time and let your loved ones know that that is the amount of time it will take so that they don't get worried about you. Now, most breast reductions can be done on an outpatient basis, but some people do hold their breast reductions overnight to monitor for bleeding and other complications. I myself do not admit my breast reductions overnight except on request or for various instances of medical necessity that we determine preoperatively. It's important to kind of go over all these things with your surgeon and what you can expect the day of surgery, because remember, it's your body and your results that matter.